Welcome to the new edition of the show From the Heart of Europe, this time in English. Today we will talk about high-level summit in health diplomacy entitled Breaking Boundaries, Navigating Health Policy and Diplomacy in Clinical Trials and Bioethics, organized by MEP Zeljana Zovko and Vice Chair of the EPP Group in the European Parliament. It is my pleasure to welcome our guests, Zeljana Zovko, MEP, Professor Gralnek, President of the Institute of Gastroenterology and Hepatology, EMEC Medical Center, Afula, Israel. Welcome.
Thank you.
Welcome also to Professor Marianna Arvanitakis, ESGE Treasurer, Erasmus University Hospital, Brussels, Belgium. Welcome. And Dr. Jasna Karacic Zanetti, Head of the Health Diplomacy Unit. Welcome. So once again, welcome to the European Parliament in Brussels. And a question to Ms. Zovko. Is European Union advancing on its path to becoming a health union? Do you think that the pandemic accelerated EU's efforts in creating more resilient and stronger health policies?
First of all, I would like to welcome my guests and to say that this is health diplomacy in its best, because what we are doing here as a representative of our citizens are addressing the concerns that we have faced throughout the pandemic that we have, the COVID pandemic, and the fighting against, and to have the same approach to the fight against this terrible disease that happened to all of us. But in the meantime, throughout this pandemic, we found out that many of the diseases that were not being treated, or that they were not being discovered, or that they were not being checked in the people, in the patients, are coming out and coming to also to the great expense of the medical, if I can say, profession and industry, and also we are facing lots of complaints, lots of different issues that patients are not having the same sort of treatment in all the countries and the same approach to the treatment. So the pandemic has shown to us in the beginning that we don't have the same access to the vaccine, that we didn't have the same access also to the same treatment as well of the patients, the same protocol. And I think that this conference will also help to understand that we need to each disease that we are treating and that we are fighting to have a unified approach, that we have the best, and that with this sort of planified and this sort of unified experiences that we are having, and that I'm going to have today experience from my guests, that we should also incorporate in our plans for health union, and to our approach as well of getting new medical equipment and treating the pharmaceutical industry that we are treating in the European Union. And it's bits of pieces that, as a patients, that we are finding out, especially from like MEPs who are coming from different countries and spending the time here in Brussels, that we have all completely different experiences, and that we are in need of health union.
Thank you, Ms. Zovko. Professor Gralnek, what is the European Society of Gastrointestinal Endoscopy, and what do you do to ensure patient rights and safety?
So the European Society of Gastrointestinal Endoscopy is the largest organization in Europe, or medical society, that deals with gastrointestinal endoscopy. So procedures like gastroscopy, colonoscopy, and even more advanced endoscopic procedures. These are procedures that can prevent cancer, GI cancers, so gastric cancer, colon cancer, pancreatic cancer, and also treat these types of diseases as well. We are an organization that represents more than 40 national member societies from Europe, North Africa, and the Middle East. And we have over 4,000 individual members as part of our society. We publish multiple guidelines, position statements that tries to standardize practice within endoscopy. You were talking about that we have standardization. as a society, we find it extremely important to deliver the best healthcare. We should have standard practice within endoscopy, and those are the things that we are aiming for. You were asking about patient rights. We actually are publishing a position statement about this whole area in terms of how to get informed consent from patients prior to undergoing these types of procedures. What is the standardization that we all should be using? So this is guidance that goes all over Europe to all of our member societies and is even adopted farther afield outside of Europe.
Professor Gralnek, did you find any obstacles from health policy to implement it in practice?
I can't say personally we found obstacles. This is guidance or guidelines that we provide to the physicians. What they're able to do then within their own home countries or local areas, they can use this guidance to say, look, this is evidence-based, comes from a reputable medical society. This is what we should try to implement when we work with our patients.
Okay, thank you, Mr. Gralnek. So, Professor Arvanitakis, what is also to you showed the question, you are awarded to you also the question, did you encounter any obstacles in implementing health policy in practice as well?
But this is something that we felt during the pandemic.
Okay.
Because we were at least in Belgium where I work, we're very used to having everything we need to provide quality healthcare. And when we were confronted with the pandemic, we really had very much less resources. There was a lot of concentration, of course, on the patients that had COVID. So finally, this was the first time that I personally felt that I could not take care of my patients as the way I wanted to.
Okay. You were awarded, if I'm not mistaken, with the European award for the best medical practice in the COVID-19 pandemic. So many hospitals had lockdowns and stopped performing invasive procedures due to fear of getting infected. You, however, continued to work, taking all risk, and your patients continued having excellent care, especially chronic patients. How did you manage this stress?
So first of all, I continue doing my job, and I think I represent also many of my colleagues and also healthcare professionals, because we shouldn't forget the nurses and all the other people that were working that just wanted to continue doing what they were supposed to do, taking care of patients. The only thing that we did was that we also tried to continue to take care of non-COVID patients, because it's important to remember that there are other diseases. So we were lucky to have a good hospital policy that managed to keep this healthcare ongoing, and we also, for the interventional procedures, the endoscopy procedures that we were doing, we tried to keep doing them also with the help of the ESGE recommendations that we provided for how to do this during the pandemic without putting at risk the health of healthcare professionals.
Thank you, Dr. Arvanitakis. Now we turn to Dr. Karacic Zanetti. How is it possible to incorporate science and evidence base into politics?
So, science and evidence in politics are crucial for informed decision making and effective governance. And initially it was a big challenge for me to base protocols and other policy decisions on scientific evidence, because it's not popular among politicians and diplomats, and the science doesn't interest them. But with the evidence as a background, we could have more confidence and made fewer mistakes in our decisions, especially about emergency preparedness and pandemics as COVID-19. So politicians can create experts, advisory panels composed of researchers and scientists, and as we have today, our clinicians from the hospitals that work directly with the patients, and ensure transparency in the decision-making process. And when a policy does not achieve its intended goals, evidence should inform necessary modifications. That is important.
Thank you, Dr. Karacic Zanetti. And the last question, journalists often call you to provide an opinion. How important is it for politicians to have the public trust?
trust, yes. Public trust is absolutely vital for politicians and diplomats. It is the bedrock of any leadership in work. When politicians have the trust of the public, it enables them to implement policies and make decisions with confidence, knowing that they have the support of the public, of their people. So for politicians earning and maintaining, most important, the public trust is not only important, it's essential for the successful and responsive government.
Thank you very much for this insight. And dear guests, I thank you very much for participating in the show from the heart of Europe. And I wish you a lot of success in navigating health policy and diplomacy in clinical trials and bioethics and breaking boundaries, as it is the title of high-level summit in health diplomacy in the European Parliament this week. With us today in the open studio of the European Parliament in Brussels were Zeljana Zovko, Croatian member of the European Parliament and vice chair of the EPP group, Professor Ian Gralnek, ESGE President, Institute of Gastroenterology and Hepatology, EMEC Medical Center, Afula, Israel, Professor Marianna Arvanitakis, ESGE Treasurer, Erasmus University Hospital, Brussels, Belgium, and Dr. Jasna Karacic Zanetti, Head of the Health Diplomacy Unit. I'm Alen Legovic. See you soon from the heart of Europe. Follow us on YouTube channel, follow Croatia, follow Europe, follow us from the heart of Europe.